So glad to introduce a very smart company from Ecuador. The company is led by Carlos Robles. He works in a beautiful advanced center for biliopancreatic endoscopy. So the name of the company is MDCONSGROUP, and I think they're ready to go.
This is the new era in gastrointestinal endoscopy, the AI technology, one of the best procedural innovations of the year.
And it's my pleasure, together with Pradeep Bandari, to present you the winners of this year's Innovations of the Year.
The AI developed by MDCONSGROUP, world's pioneers in the use of artificial intelligence in echondoscopy and cholangioscopy, detects malignancies in patients during cholangioscopies, recognizes the patient's anatomical structures in real time during echondoscopies, and thus provides them with faster and more accurate in diagnosis and treatment, training professionals in the area more effectively and helping medical centers enhance their interpretation skills during echondoscopies. The truth is, the artificial intelligence has become the most important innovation in medical procedures, a leap into the future, using this new technology in echondoscopy and cholangioscopy, a precise, efficient, hands-free work holographic device that increases users' accuracy and output during medical performances, the ultimate interactive mixed reality device in today's medical field.
I want to welcome our guests from Ecuador. Please feel free to introduce yourself, Juan Carlos and Marta. I think Juan Carlos is a technician, more specialist in AI, and Marta, she's a physician. Is that correct?
Yes, thank you. Hi, I'm Juan Carlos Mendez, lead data science engineer here in MDCONSGROUP. And this is Marta Arevalo, research fellow, who helps us with the studies with our products here.
Okay, we're ready to your presentation. You can start.
Okay, so we wanted to explain a little bit how the technological advancements will affect the future in endoscopic procedures. So MDCONSGROUP is a leading company where we develop new technologies and innovation. We mainly specialize in artificial intelligence and software development. So we have dedicated more our efforts on solving limitations for echondoscopy and cholangioscopy. Some of these limitations include the learning curves, the time.
The learning curves for fellows who are learning echondoscopy, because sometimes they take till 2 years of the waiting for a fellowship center who can accept them. For example, here in IESED Ecuador, there are people who take till 2 years to come here and learn from Dr. Robles, and they only stay here kind of 3 months. Okay, so this is hard.
Among other of the limitations, we also have a few training centers, the cost of training, and the inter-observer agreement, and the operational skills. This applies for both of the procedures. In regards of these softwares that MDCONSGROUP has developed, our institution has won some abstracts in 2021 for Best Procedural Innovation at ASA. We won an award for the application of artificial intelligence in real-time anatomical recognition during endoscopic ultrasound. And in 2022 in Tokyo, we obtained the Meinhardt Class and Abstract Award for the expert endoscopies versus artificial intelligence in the evaluation of undetermined biliary strictures in cholangioscopy. So as we were talking, our main efforts have been led towards creating a software for EUS, which is called AWorks EUS, and for cholangioscopy, AWorks cholangioscopy. So this is a live procedure that took place last year in the 6th Life Online here at Ecuadorian Institute of Digestive Diseases, where Dr. Robles used the software to identify neoplastic lesions within the biliary tract. As you can see, there is the green bounding box that shows where the lesions are. He performed this procedure next to Dr. Kunda.
So as we see, it's detecting every vascular, malignant vascularity here based on Robles-Mendoza classification. How did we develop this? So we'll see. So, how did we develop this? We have a data set from 5 centers around the world, including Guayaquil. And we have more than 500,000 samples extracted and curated, of course, before developing the model. So it detects the 4 stages in the classification without getting a mistake. We have a 92% of accuracy. We'll make the numbers next in the presentation. So this one is AWorks for EUS. This is aimed for detecting anatomical structures in an endoscopy, linear and radial. As you see, it's detecting every anatomical structure in the gastrical window in an endoscopy. You see the liver there. It keeps track of the movement of the anatomical structure. There's the IVC, vena cava. This is more aimed for helping the fellows who are learning this kind of procedure. Besides the other software, that is a CAT-E software for detecting, this is a CAT-E software for learning. Okay.
Yeah, so the importance of this is as we are trying to learn the normal anatomical structures, and we are not aiming only to learn about the diseases. So this is why this helps for training.
So this is a software as a medical device, works with every brand. We have tested this with Olympus, with Pentax, and the AWorks cholangioscopy we have tested with Microtech and Boston Scientific, for example. So how did we design this technology? Of course, these are artificial intelligence software. This depends on a model. Commonly, in a model, you have your engineers label the samples. They recollect the data set, they label the samples, and they send the training process. Here we do something different. What do? We take every procedure from a center, from 2 centers here in Ecuador and centers in United States, and we pass it to software in the cloud that auto-trains this. it uses something called motion tracking for the samples, you see, and it auto labels them. Of course, they are checked out by a specialist, by a physician, like Dr. Robles, just to be sure that they are accurate and they are valid. They do the validation, of course. And that's it. We have more than 100,000 samples per day. Accuracy is always performing better, and loss is always coming to almost zero. This is an example of the training process we have every day. We're convolutioning samples from 5 different patients in the morning, for example. This one is live. Well, was live when we made the presentation, of course.
And for example, like for what we were talking about the cholangioscopy AI-aided software, we used 170 videos. They were analyzed with a second version of the model, and we had very, very good values. We had a 91% sensitivity, around 68% specificity. The positive predictive value, 74%, and the negative predictive value was around 88%. And what was important about this study is that the software achieved or outperformed 2 non-experts and 1 of the experts. Those are like overall the neoplastic vial duct lesions were distinguished with very good accuracy. We already published these results last April in endoscopy, and you can check also the clinical trial, which has under number 05147389.
Actually, with this software, both of the software for cholangioscopy and EUS, we're pursuing resubmission of FDA. We're currently doing the multicenter study with FDA protocol for these products.
Yes, we are.
So, one more thing. Besides the developing CNN models, we're aware that we can use this training process to develop another kind of product, for example, holographic technology. We have developed a device that converts every digital signal into hologram for mixed reality in this HoloLens, for example, and the incoming Apple lens that you all have to know by now. This is compatible with any kind of processor, with any brand. You just plug and play, and you can see the holographic screen instead of your regular monitor. You will save money, will save space, and will save energy with this. Let's see a video.
And you're able to get like up to 9 different screens from different processors. So
yes.
that's really good. But so far, the endoscopists that have used this device have been used around 2 screens, 3 screens. I think a couple of them use like 4 screens. So this is very useful for learning purposes, teaching purposes, guidance from anywhere in the world. So I believe this is the future.
Yes, for example, here we're looking at a live procedure being performed with this. Instead of the regular monitor, it has 0 delay, no lag, and it has the best resolution. Of course, the resolution depends from the processor, from the original processor. Yeah, here, there's another example. Mixed reality holographic screens at replacement for monitors in endoscopy suite. As we can see, those are the regular monitors. Yes.
So it's important to note that it's not only something that will make more comfortable the procedure itself, but it will also avoid eye fatigue and it's a greener option for.
Yes, this is our device, for example. You see, you can pair till 20 glasses at the same time for the same procedure, and you can have till 9 monitor signals here. You see, you can rotate them, you can move them, you can make them bigger, make them smaller.
You can use hand gesture as well.
Can use hand gestures. This is an AI-driven software. Why? Because we had to develop some models for gestures, for detecting gestures, for detecting voice commands, of course, and for detecting the more comfortable side of every monitor in every iris, for example. It is synchronized with every iris of every physician here. That's the important thing. So we have implemented all those models in one device. You see, he's controlling 9 screens at the same time of 9 kind of procedures here.
And of course, these lenses and this software is compatible with our other softwares as well.
Yes, of course. It is fully capable for AWorks Endoscopy and AWorks Colonoscopy. See? That's the magic of reality.
Yes, it is.
So, we would be delighted to clear up your doubts here.
So, any questions?
Any questions?
Marta. So I thank you for this very impressive presentation.
Okay, now we're able to hear you. Sorry.
Yeah, I was just congratulating on the vision of this presentation that is very new, because we always talk about AI for colonoscopy or for upper endoscopy, but we were somewhat not thinking of the biliopancreatic. So the first question for you, one is, what is the difference in training an algorithm for ultrasound as compared with endoscopy? What is more difficult? Where do you need more imageless? Where do you need more validation or more variety in the input to avoid overfitting or anything like that?
Okay, that's a very good question. And that's the reason US took more time to train, because the black and white, you don't have color here. Mm-hmm. You have to be very careful from converting in the data set before the training, before entering the matrix from the neural network. That's the first thing. The second thing, every anatomical structure is different in every person, in every region. So we had to train, for example, pancreas is a lot of fat, has a lot more fat here in Latin America than in Europe, for example, or in the States. That makes the pancreas detection more difficult. So we had to take that apart, make that reviews, more validations, and once you have that, you can begin convolutioning the model. That's why it's more difficult. Yeah. But we are, I think, because the here. Sorry.
Yeah, Marta. In EOS, especially in training, it is not so easy to identify the anatomic landmarks. So it takes a lot of time for a trainee to realize where he actually is before making a process of diagnosis. So how much important is, in your view, an AI that assists us in recognizing the different anatomical landmarks, irrespective of the diagnosis that we will make?
Well, I think that this would greatly help for any trainee. At the beginning, I think anybody would feel like very insecure about identifying any structure. So this will give that little pat on the shoulders, that reassurance that, okay, this is what it is, I think it is, and I'm not doing anything wrong. And over time, trainees will be very sure about what they're looking at, and procedures will be performed in a better way. And overall, I think this is a great thing to use. The learning curves will certainly shorten. We have already seen that with some of our trainees. And I think this is the way to go.
Yeah, thanks, Marta. Juan, coming back to your last innovation in the field of virtual reality, and I thank you of presenting here it in Endoscopy On Air. Can we envision a future of remote endoscopy where the endoscopist is not in the same room as the patient, but anyway, by the assistant that you provided, he can actually understand what is happening in the room and maybe doing the procedure in a remote setting. Is this where we are going, Juan, for you?
Yes, we are aiming on working towards this. There is an application within our software that's called the rental board. The R is for remote intelligence. It's for assistance remotely.
Yes, this work with remote assistance as well. Tomorrow, for example, in Dr. Robles' procedures, you will see an example of this. You can see one person giving assistance to another physician. They're in the same room. Yes, this is the whole purpose of this. I
feel this is hugely important. For instance, if we also think of all of the developing countries here around Europe or globally, with all the troubles in providing training, this can be really a game changer and a breakthrough. So I just thank you for your presentation, and we will see you tomorrow in the marathon of Endoscopy On Air. So thanks, Juan, and thanks, Marta.
Well, thank you for having us.
Thank you. Great to see you.